It's really important to be able to adequately conduct an eye test in general practice, to be able to assess a patient. I think the general practitioner has the hardest job in medicine because they have to work out which patient is the acute emergency, which one they've got a little bit more time with, and which one is not an emergency at all. In the sessions that we're covering, we're aiming to look at upskilling general practitioners in how to effectively assess a patient's vision and optic nerve function, as well as gaining some basic skills on how to address whether this presentation that they have in front of them is an acute emergency and the patient could go blind within the next couple of hours. For example, a bacterial keratitis, the patient can lose the eye within hours. Or is it something that they can manage over weeks and that they can institute various different types of treatment like blepharitis? GPs need to be able to be adequately prepared to deal with any eye disease because their patients are very anxious usually when it's their sight that's at risk. But the things that are acute and they really need to be able to be on top of are things like a patient presenting with red eye or an ocular trauma. They're things that we're going to cover in the session. Other things include being able to do adequately a 4-year-old child's vision assessment, which can be very difficult with a 4-year-old child. But this is part of the screening process that's part of the immunisation. So these are the things that I think are really important for a general practitioner to be able to cover. But even if they are able to have the skills to do further examinations, then all the other eye problems they'll be able to discuss with their ophthalmologist if they have any concerns. In the session that we're going to cover in the GPCE this year, we intend to particularly address skills for general practice. So we intend to be able to upskill the general practitioner on how to assess a patient's vision, how to be able to assess their fields, and how to be able to assess the other components of optic nerve function quickly and efficiently in their rooms. They also will be taught things like how to remove a foreign body, how to use a direct ophthalmoscope. Childhood vision screening is essential, as this has now fallen a large part on general practitioners as part of the 4-year-old immunisation vision screening check. And this we will go through as well on how do you adequately assess a 4-year-old's vision.